Hi everybody, my name is Paola. I'm going to be your instructor for this class. I'm really excited to be going on this journey, this sectional anatomy journey with you guys. A little bit of background on me. I am a radiation therapist. I have been a radiation therapist for 8 years now. I am currently working at Advent Health Orlando. We do get some of your students there. I'm very excited. If I've met you before, hello again. If I've never met you, it's nice to meet you. So let's get started. Sectional anatomy. First of all, why is it important? So sectional anatomy relates internal structures which allows you to gather information from the image. So if you look at a slice, if you look at an image, whatever image it may be, you're not going to know what it's trying to tell you unless you understand sectional anatomy. In this case, I know it says it right here, axial CT of the hips, but I didn't even need it to tell me that it was number one, a CT, because I know that CTs have this type of grayscale. I know that this is what the human body looks like through CT. I didn't need it to tell me that it was of the hips because I know that this is the acetabulum, and because I have these directions here at the bottom, I'm able to tell that this is the right acetabulum, the left acetabulum, and the femoral heads. But without it even giving me that, I could see that there's bone down here too, so I knew that this had to be the tailbone, in other words, the coccyx. And if this is the tailbone, this is the right, this is the left of the patient, then this over here, the top of the image, is the anterior part of the patient. I can also tell that this big black bubble here is actually a bubble of gas that's within the rectum. How do I know that it's gas? Because air in CT comes out as black and bone in CT comes out as white. So look at all that information I got just from looking at this square here. I know this because for radiation therapy, being able to analyze images, it's the foundation of your technical skills. You're going to be sitting in front of computers that are going to be taking images all day long. So when you do a simulation, you're going to be performing CT scans on patients. If you ever form part of treatment planning or the dosimetry, you will be looking at CT scans of patients. And then when it comes to treatment delivery, you're going to be taking MVs, you're going to be taking KVs, you're going to be taking cone beams. And then if you ever work on an MR-Linac, which I have, you're going to be taking MRIs of patients all day long. So you need to be able to read the image that's in front of you. You need to be able to gather information from that image in order to really know if, first of all, if the target is aligned, if the structures that want to be protected are not falling into the treatment field, and whether or not you need to go in there and reposition the patient in order to achieve those goals. Anatomic position. So the anatomic position is exactly what you see here in this little image of this person. Anatomic position is standard all through medicine. It is when the patient is facing you, standing up. If they were standing up straight, if the patient is facing you, their palms are facing forward, and their feet are facing forward. That is anatomical position. If you were ever to talk about the anterior of the hand, the anterior part of the hand is the palm, because in anatomical position, the front of the body, or the anterior part of the body, it includes the palms facing forward. So the palms are part of the anterior of the person. The back of the hand is actually considered posterior. The toes are anterior. The heels are posterior. If a patient is lying in front of you on the table and you're trying to talk to your partner about which direction they need to go, superior, you're talking about towards the head, inferior, you're talking about towards the feet, and the left and the right are always going to be opposite of what your left and right are, because anatomical position has the patient with standing up straight with their palms forward, their feet forward, and facing you. So their left is going to be your right, and your right is going to be their left. When we're talking about planes, this is probably the most important part of this entire lecture. You need to know your planes. We're going to be talking about images and the types of slices that we're going to be looking at and the types of cuts, they're going to be referring to these planes. So the sagittal plane in this image, it's the purple line that's dividing the patient between the right and the left portions. Um, the coronal plane in this image, it's the green. It's a vertical line or vertical plane that passes through the body, and it divides it into the anterior or the front and the posterior portions. The other way of saying is the ventral. So the anterior is the ventral and the posterior is the dorsal. Anterior is the front, posterior is the back. The axial or transverse plane, it's this yellow one right here. It's a horizontal plane. It's the only one that's horizontal, guys. Horizontal plane that passes through the body, and it separates it into the superior and the inferior portions, so the top half versus the bottom half. And an oblique plane is any plane that passes diagonally between the axes of two other planes. So whenever you see an image that is taken from a slice of the body that's going diagonally, that is considered an oblique plane. Regional terminology and directional terminology. These tables are so important for you to learn, so important for you guys to have. Let me move myself over so in case you want to be able to read these. We use these terms in clinic every day. If the doctor tells me, oh, make sure the inguinal nodes are lining up. What is he talking about? He's talking about the lymph nodes in the groin. And I need to be able to scroll to that image and to verify that the contours are lining up appropriately for the inguinal nodes. If my therapy partner is like, hey, is the sternal contour on, then I need to know that I need to scroll over to the sternum and make sure that the sternum is lining up appropriately. When we're talking about vertebral, we're talking about the spine. Again, all of these terms are incredibly important, but some of them are very easy. I know that a lot of these you guys have seen before. You don't need to memorize this table for the first time in your life, because a lot of these are very familiar. Like pedal. If we're talking about pedal, we're talking about the foot. But I know you guys have seen pedals on bikes before, so that's an easy one, right? Sacral remains to the sacrum, sternal to the sternum. These are, very closely related to those other words. Directional terminology has a lot to do with anatomical position. So superior and inferior, the superior part of the body, the inferior. If the doctor's telling you like, oh, you know what, the ISO, the treatment target for this, I'm actually going to place it superior to the clavicle, then you know that your clavicle is here, superior is going to be going up towards the head. So it's going to be higher up. Know these terms, memorize these terms, be prepared to be quizzed on these terms. Not because I want to give you guys a lot of information to remember, but because you're going to be using these every day in your clinic. You're going to hear them all the time. All right. External landmarks. So external landmarks are skeletal landmarks that help identify the location of internal structures. These are basically, think of them as like reference points. Like if you were looking at a map of the United States and I said like, oh, I'm traveling somewhere near the Northeast. Okay, the Northeast is kind of like that external landmark I'm giving you. If the doctor tells me, I want you to do a CT scan, and I want it to include between C5 and the iliac crests. When I lay a patient down on the CT scanner, I can't see C5, I can't see the iliac crests, but because I know that C5 is in the middle of the neck, I know I'm going to start my scan here. Because I know that the iliac crests are right below the umbilicus or the belly button, I'm going to end my scan there. So once you know these terms and where they are located in the body, it becomes very useful as a radiation therapist so that you're not exposing the patient to unnecessary radiation because you don't know what the doctor's talking about or you don't know the area of interest. Know your external landmarks. Similarly, know your internal landmarks. So external is talking more about bone. Internal, we're talking more about vascular structures that, again, help you identify internal structures or where certain organs are lying. You need to know your carina. Carina was asked in my boards. I remember that question specifically. Carina is at the level of T4, T5. Memorize that, please. You should know that your aortic arch is 2.5 cm below the jugular notch. You should know that the aortic bifurcation is at L4, L5. So all of these tables They are from the first chapter of your reading, so they are very important. Please take the time to review them, to memorize them. Very important structure within these tables. All right, your body cavities. So the two main cavities, major cavities, are the dorsal cavities and the ventral cavities. The dorsal cavities, if you remember directional terminology, we're talking about the back of the body. We have the cranial cavity and the spinal cavity, and within each one of those cavities, we have the brain and the spinal cord, respectively. So, cavities, we're talking about spaces within the human body that carry certain organs. It is important that you know what organs lie in which cavities, and it's important for you to know, of course, where these cavities are. So for example, what organs can be found in the abdominal cavity? You should be able to say the liver, the pancreas, the stomach. These are all organs within your abdominal cavity. These are questions that will come up in your boards, and these are questions that I will definitely include in your quizzes. So please take the time to review your body cavities and what kind of organs are found in each cavity. The abdominal and pelvic division. So the abdomen and the pelvis are divided into quadrants, and they're also divided into regions. First, you're going to look at the 4 quadrants: the right upper, left upper, right lower, left lower. Pretty easy, pretty self-described, pretty self-explanatory. Please take the time to know and review what structures or what organs can be found within each quadrant. This is information that you need to know. This is information that I will reference to when we're looking at scans throughout the course. And also, the quadrants are divided by 2 lines. The transverse plane actually travels through they both meet at the umbilicus, but there's a transverse plane that goes horizontally through the umbilicus, and there's a mid-sagittal plane that goes vertically through the umbilicus. So please take the time to look at the anatomy that is within each one of the quadrants. It is important that you know that. There's also, just to complicate it a little bit more, no, just kidding. But there's also an even further division of the abdominal and pelvic cavities. So there's also the regions. There's 9 different regions, starting with the umbilical region in the center. I like to start with the center, and then to the sides of the umbilical region, the right and the left. Remember, anatomical position. It's not your left, it's the patient's left. So the left lumbar and the right lumbar. Why? Because these are close to the lumbar spine. That's why it's lumbar. If you're looking at the hypogastric region, it's hypo means below. Hypogastric, so below the gastric region, if you want to call it that. You have here it is, the hypogastric, my bad, central region, inferior to the umbilical, so inferior to the center. You have the right iliac region, the left iliac region. Again, very self-explanatory. The iliac is referring to the iliac bones, the hip bones, and the right and the left side, anatomical position, guys. Epigastric. Epi means above. So if the hypogastric is below the umbilical region, the epigastric is above the umbilical region. And again, right and left, anatomical position. Hypochondriac. The easiest way to remember this is to actually know what they're talking about. Hypochondriac means inferior to the cartilage of the rib cage. So the left hypochondriac region is referring to the organs that can be found under the cartilage of the rib cage on the left side of the body. So from here, this image, I can see that definitely part of the stomach is there, and most likely the spleen. So those are the organs within the left hypochondriac region. Please take the time to review this image and to understand what each one of these terms is referring to. It is important that you know what organs can be found in each region. And finally, we're going to talk a little bit about image display, CT acquisition, MR acquisition. So when you're taking a CT scan, you acquire those images using ionizing radiation. For MRI, you actually use strong magnetic fields and non-ionizing radio frequency energy. When you acquire a CT scan, we're going to be focusing on CT mainly. When you acquire a CT scan, you're going to have an image that is created. If you're looking at just the axial slice looks like this, transverse slice, if you want to talk about it that way. It's basically a 2D image. It's two-dimensional. This image is composed of pixels, all right? And that's why you see this right here. It's a pixel. Pixels, same thing that you see on your screen, on your phone screen. When you're talking about pixels, you're talking about a 2D image. When you're talking about a voxel, you're talking about a stack of pixels. So voxels is actually referring to 3D images. Pixels is referring to 2D images. So each pixel is assigned a specific value based on the density or the attenuating property of the tissue. Each value is a shade of gray, and in CT, the shade of gray is called a Hounsfield unit. It is very important that you guys know that the Hounsfield units are basically referring to different shades of gray. And when the Hounsfield unit is negative 1,000, the color is black. And when the Hounsfield unit is positive 1,000, the color is white. And when the Hounsfield unit is 0, it's water. It's gray, and it's referring to water. So air is black. It has a Hounsfield unit of negative 1,000. White is bone, very dense bone, and it has a Hounsfield unit of positive 1,000. And everything in the middle is all those other soft tissue organs that you see within your body. Here in these images, you can see it's the same image with different what we call window levels. So window width is the parameter that adjusts the grayscale. So let's say you only want to look at an image that has a window. In this case, if the window is from 1,000 to positive 300, I only want the window to focus on that region. So I only want to see the grays, these shades of gray. I only want to look at these shades of gray, right? And then the window level is where you want to focus where you want to set the center of that grayscale. Let's say I want to center the grayscale at, let's see, 200. So let's look at this image, for example, the lung window. I like this one. The window level, they set the center of it at negative 500. Why would they do that? Well, negative 500 is actually a pretty dark shade of gray, and air is black. So I understand now. They want to focus on pretty dark shades of gray because the lung, these little bronchioles are very, very difficult to see unless you get very, very close to that air or that black. So you want to be able to focus on, at least in this case, the window level is set at negative 500, very dark shades of gray, because that's when you're really going to be able to analyze or appreciate those bronchioles. If your window level is 50, which you can see in the mediastinal window, you can't see any of those bronchioles. It's just black air. Why? Because that's not where you're focusing the center of the grayscale in this scenario. The different parts of the body will require different types of window level for you to really appreciate the image and see the structures that you want to see. And you're going to hear me talking about different types of window level throughout the course as well. All right, and multiplanar reformation. So here we're talking about the reconstruction of images. So reconstructed images that result in sagittal, coronal, axial, and oblique views. What does this mean? When you acquire a CT, the CT is actually taking a bunch of axial slices. So they look like this. It's like taking a bunch of different slices. The patient's traveling in, it's taking a slice here, a slice here, a slice here, a slice here as the patient travels on the table. The reformation happens when you stack all those slices together and you're actually able to acquire coronal and sagittal views, something you wouldn't be able to acquire from a CT scanner in general. This is all a reconstruction or a reformation from the axial slices. The true image is your axial slice. Their coronal and sagittal views are actually reformations. That's why they're never as crisp as your axial slices are. And here's a little cube. It's just kind of giving you, it wants you to think in 3D now. So if you're taking in 2D, this is the image that you're getting, just one single slice. When you're thinking in 3D, you're stacking each one on top of the other, kind of like this, or just like this. And you're able to create kind of like a cube of information. And if you want to see within the cube, you have the possibility to create a sagittal view. So in this case, it looks like this. You have the possibility to create a coronal view, which in this case looks like this, or you have the possibility to just scroll through the original slice that you acquired from the CT or MRI, which looks just like this, the axial. Curved planar reformation, it just talks about an arbitrary curved projection through the cube. So let's say you want to see a curve through the cube. In this case, looks like this. You can do that too, and it's called curved planar reformation. 3D imaging, just to finalize this chapter, it uses the principle of ray tracing. So imaginary rays are sent out from a camera viewpoint and the data are rotated on an arbitrary axis. The rays pass through the data in specific increments. So what does all that mean? There's different kinds of 3D imaging that we can get. This shaded surface display, basically every voxel, remember voxel because it's 3D, every voxel with a value greater than the selected threshold is rendered opaque. So you basically set a threshold and then it'll turn into like this opaque image, or basically will focus on that level and you'll be able to recreate a 3D image that way. The MIP, which is the maximum intensity projection, the ray is directed to stop at the voxel with the maximum signal intensity. So only the brightest voxels are mapped in the final image. This is an MIP, this is an SSD, this is a VR. It's all the same image. It's just being reconstructed in 3D in different forms. So the MIP, it's focusing on the maximum intensity. In this case, it's looking at the vascular structures and almost like calcifications. And I'm sure they added some contrast to make it even brighter so that the maximum intensity, or the white, would light up really nice in this image, which is exactly what we got. And finally, the volume rendering. Its contributions of each voxel are summed along the course of the ray, and this is repeated numerous times to determine the pixel value of the final image. So in this case, you are able to sum up the different voxels, and then it creates, we call it a 2D image because at the end of the day, this is a 2D image of a 3D representation or a render. Of the body, or of the thoracic cavity and the abdominal pelvic regions. All right, a lot of information. I hope that I was able to go through it clear enough for you guys to understand. I'm looking forward to the next class, and I will try to stick to this type of method of recording and going over information, and that way we can take the live session to really go through slices and scroll through scans and take the time to go over any questions you guys have. Have a great one, and I will see you guys next time.